A lot of people don't know this, but the very first time a pilot flies the actual airplane, there are passengers in the back. It's a revenue flight. In fact, there's nothing that distinguishes the first time a pilot flies an airplane from any other routine flight. It could be a charter for a sports team or a VIP, or it could be a nonstop flight from Atlanta to Paris. At some point in a pilot's career, it is their very first time flying the airplane, and it's because they train in a simulator. The value of the time spent in a simulator is probably an order of magnitude greater than the value spent actually flying the airplane, because the experience is condensed. They can practice the most difficult procedures, the most difficult emergencies, many, many times until they get it right.
In 2018, the Medical Center Open will raise funds to help purchase a mobile simulation lab. This sim unit will travel to locations throughout Northeast Georgia, bringing state-of-the-art training to medical providers.
The way we learn as human beings is we need to experience things, especially complex behaviors, several times, often many times, until we do them naturally, and we do them comfortably, and we do them with minimal likelihood of error. In healthcare, traditionally, we've learned those very complex procedures, behaviors, tasks on the job with real patients. Historically, we've probably harmed a fair number of patients as a result of the learning process. Simulation shortcuts that learning process and allows us to get experience without risk of harm. We still will make mistakes while we're learning, but with no consequences.
In the mobile simulation lab, learners will be immersed in realistic experiences. This hands-on training allows staff to prepare for rare, emergent, and life-threatening situations, so that response times are decreased and teamwork is improved when facing real-life events. Simulation training is especially critical to meet the educational demands of respiratory therapists, trauma program providers, EMS professionals, nurses, and other caregivers. Because the unit is mobile, it will increase efficiencies and impact healthcare training opportunities for providers across our growing region.
There's much more to simulation than building technical skills. It's often thought of that simulation is optimal for learning how to use your hands, how to do a procedure, but in fact, the real value comes from the non-technical skills, which is the teamwork, the mental preparedness, how to respond when something goes wrong or something unexpected happens. In the simulator, we're able to build a bank of experience upon which we can draw in a time of real crisis. And that enables us to act optimally, smoothly, effectively, without panic.
Now in the 27th year, the Medical Center Open is widely known as the area's premier fundraising and golfing event, changing lives locally by partnering with the community to impact health. With 100% of this year's proceeds going towards mobile simulation, healthcare providers across the region will be better equipped when responding to critical and emergent situations.
There are limitations to how good we can get if we fly by the seat of our pants. And by practicing with simulation, we can raise the bar and truly deliver world-class healthcare.